On this week's Health Talk, we will discuss the latest advances in surgical treatment of gynecologic cancers.
It's our pleasure to introduce you to Dr. Linus Chuang. He's a nationally recognized expert in using minimally invasive and robotic surgery for the treatment of GYN malignancies.
We've got a great show ahead, so stay tuned. We're up next. Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're going to discuss the exciting advances in the surgical management of gynecologic cancers. We're joined by Dr. Linus Chuang. He's a newly appointed chairman of obstetrics and gynecology for the Western Connecticut Health Network.
Thanks so much for joining us today, Linus, and welcome. Welcome.
Thank you very much.
Yeah, welcome to the network. Welcome to Connecticut.
Thank you for having me. It's really excited to have the opportunity to speak to you and everyone about some new advances in surgery for gynecologic cancers.
Yeah, back when I was a medical student in the dark ages, surgery was a mess. I mean, there was just blood everywhere, and the large incisions to gain viewpoint, and now it's become incredibly different, isn't it?
It is really unthinkable. It's only about 25 years ago we started doing minimally invasive surgery. When it was first started, we have to peek through the laparoscope in order to do surgery. Now tremendous advancement have been made. We can do it by watching a TV monitor to do surgery, and even more recently, just in the last 10 years or so, we are able to do a computer-assisted surgery. Instead of peeking through the little camera, we can actually sit down and to do robotic surgeries.
And tell our viewers a little bit more about this. In terms of, it's not a robot doing everything on its own, right? It's really the surgeon directing via a computer.
Correct. In the traditional laparoscopic surgery, the surgeon and his or her assistant stand by the patient's side to look at the monitor and to do surgeries through these small incisions. For robotic surgery, the surgeons actually stay away from the patient with the instruments actually connected through a robot. And this robot is huge, it's 800 pounds. So the surgeon actually sit about 15 feet away in the console and watching through a three-dimensional viewing glass, so things can be seen really clearly. And what is different between laparoscopic and robotic surgery? When I give talks, I usually describe it as something you're going to laugh is. For laparoscopic surgery, which is very rigid, and it's almost like eating tacos with your chopsticks. But for robotic surgery, with great degree of movements, so it's really like eating tacos with your hands.
Now the old, what is now old laparoscopic surgery, you had a pipe with a little camera at the end, so you were sort of looking through a relatively small, like looking through a keyhole.
Correct.
And now I've sat at those consoles, and I think we can compare them. Now the kids have these virtual reality games where you put on the helmets and you see three-dimensionally and you have the hands out in front. It's not too different than the robotic surgery, is it? You get that same three-dimensional view of inside the patient.
Yeah, we do see younger generations who had gone through the video games eras, and they really adopt robotic technology very quickly. But interestingly, there are a lot of surgeons who had never done laparoscopic surgeries. They are able to pick up robotic surgeries really quickly. And why? Because interestingly, robotic surgery, it's really moving back to do surgery with your hands again, instead of using instrument, because robotic surgery allow you to do surgery with the hands movement. So what is your control in your hand actually transmitted through the robot into the patient's abdomen to do the surgery using hands instead of rigid scissors. And
I think that's a really important point to for our viewers to try to understand, is that you're sitting at a console, you've got both hands connected to these devices, and then you're viewing the inside of the patient with mechanical hands, and as you move your hands and do things and look around, the console does that for you, and the mechanical hands mirror what you do. It's the point I make, it's very elegant.
It is.
And we have some pictures. I think we should bring up the pictures to give some idea
Yes.
of what this looks like.
Yes.
And
Here's our
okay,
first
so
picture.
tell us what we're
So
looking
you
at
can
here.
see this is my team here. You still need a human being in doing surgeries. So I have my assistant, my two wonderful assistants, and I have my the nurse there. So you still involve human in doing surgeries. And this is the picture. We are getting ready to do the robotic surgery. As you can see in the next slide, here the robot is being pushed in to connect with the instruments on the abdomen. And you see this 800 pounds gorilla and going
And this
in
is on the
and-
right side, the thing
Correct.
that's the actual robot where you sit and are able to.
And those
driving. Yeah, it's
Yeah.
really programmed very carefully.
And the things
and the
just
things
to,
from the
yeah,
top,
well, go ahead,
the
Andrew.
white kind of things covered in plastic from the top, those are kind of the arms of the robot. Is that correct?
Exactly,
And
exactly.
they'll be
and
holding
the
the
arms
instruments.
have both cameras as well as that mechanical hand
Correct.
or fingers. If you
So
will.
as you can see here, there are 4 arms. One arm has a camera to dock onto it, and one arm is for I'm a right-hander, for my right hand with a so-called scissor, and my left hand is a grasper, and the 4th arm is a retractor. It's holding up tissues to expose where I'm going to be operating.
So you actually have 3 arms that you're able to use through the robot.
Correct.
So how do you switch from the scissor to the retractor? Is there another handle you pull on?
It's similar to driving a car. There's a crutch, you can hit it, and then you can turn to a different hand. It's a good question, yeah.
So in many ways, this is an improvement on the human being.
Exactly. So we see better, really see better, so the blood loss is less. The surgery can be done very precisely with
Let's pull up
robotic.
the
Next slide.
next slide.
So you see this is how it is dark and actually very small incisions. Many of these surgeries, even with hysterectomy in the past, we used to keep patients in the hospital. When you do an open surgery for 5 days or laparoscopic surgery, maybe overnight. Now this is really associated with a lot lesser pain, and the patient can go home the same day after hysterectomy.
It's really amazing. I've had my gallbladder out using laparoscopic surgery. Actually, laparoscopic, not robotic, but those little incisions don't hurt
No.
postoperatively, as opposed to the big old incisions that you'd have to make. Tell me though, when you're doing this kind of surgery to remove a uterus, a fibroid uterus, or an early ovarian cancer, tell people how you get that tissue out through the small hole.
This is a secret I'm not going to share with you, otherwise it's still my business. So fortunately in women, we have a vagina, so the uterus, tubes, ovaries are usually removed through the vagina. But you really bring up a good point. There's advancement both in the incisional site. As you can see, there are 4 here. And now we are progressing to be able to do it with one incision, so-called single-site incision, and that's available at Norwalk Hospital. And you also touch on the natural orifice surgery. And gradually we are actually progressing to that direction, removing, say, gallbladder, like you said, or ovary through vagina, using the natural orifice surgery. But science is really progressing, and as you can see
Now
here,
this is actually your view as you're sitting at the console?
This was a patient I had last week, and you can see on the right side is my right hand. I'm a right-hander. It's my scissor, and the left hand is a grasper, and it also coagulates tissues.
One of the things that really amazes me is just how bloodless this is. When I was a medical student, surgery seemed to me just a lot of blood. When I said it's a mess, I meant that there's a lot of blood all over it. You've got a beautiful field here to see everything. And is this the way it is usually as you?
Yeah, so for the hysterectomy, uncomplicated, even with lymph node dissection, generally the blood loss is less than 100 cc's. It's really minimal.
It's like 3 ounces, 3.5 ounces.
It can be so precise. You can see very well. That's a great thing. Now this is really interesting. The technology has also allowed us to do very precise surgery in lymph node biopsies. We are able now to give a dye injecting onto the cervix, and it can track onto the first lymph node that the lymphatic flow will go to.
Yeah, anybody that's familiar with breast cancer surgery or melanoma surgery knows the term sentinel node.
Correct.
So this is where it's really, they really show up green like that. They're using a fluorescent light
Yes.
now through the robot, and the lymph nodes are glowing green.
It's really beautiful, and it helps us to identify. So to do this will allow us to, A, to precisely biopsy the right lymph node, and B, to minimize the chance of injuring the surrounding organs like the ureter, like the blood vessels, and more importantly, to decrease the chance of patient developing swelling of their legs, or we call it lymphedema. And that's really important.
So it's really amazing how much more detail you can see. I'm not sure everybody really appreciates, but with the camera going in so far and being of such high quality, as opposed to, say, the old days when the surgeon stood outside and had to try to look in to tissues that didn't look all that different. Now you can have the camera right there at the precise location. You can inject a dye that shows you exactly what you need to take and not take. Phenomenal advances.
Absolutely. You actually also touch upon something we are moving forward to is very soon in the near future, we might be using molecular biology to tag on where the cancer cells are and to remove it. In fact, they're able now to inject this green dye to identify the better part or the bad part of the kidney and to remove it. So how technology really had helped us to precisely
using molecular sequences to bind to the DNA using a fluorescent dye to the...
So this dye will be also able to, say, inject through the vein, and they can identify which part of the kidney is not perfusing blood and to remove the bad part of a kidney. And for patients with endometriosis, they're able to light up the endometriosis and remove them. Wonderful. It's really a great direction we're heading with technology.
Now, my understanding is the results using robotic surgery are not all that different than the results using the older surgery in terms of the survival or what, but it's really an issue of pain and damage to other organs and recovery, isn't it? Which are dramatically different.
Absolutely. And so these type of surgeries, either laparoscopic or robotic, are associated with smaller incisions, so the recovery are faster, both in the hospital and outside of a hospital. A traditional hysterectomy with open technique takes 6 weeks to recover, but for laparoscopic robotic, it takes only 1 to 2 weeks.
Amazing.
So I have patients that are single mother, professional, they have the kids. Just to be able to get back to work in a week's time means a lot to them, to their family, and to society.
Absolutely.
Again, I remember the old cholecystectomies. We're not talking about robotic, but just they were 30 days of recovery at least, and a large incision on the right side. And I know I went home from the hospital the same day, and I was back at work in 3 days.
One thing about laparoscopic gallbladder surgery was really funny. The younger generations of doctors, they actually feel more comfortable to doing laparoscopic, and they are really saying, do I have to do open? They might not be say I have to go and review. So how the generation have changed to adopt this and becoming a standard of care, which we have available both in 2 hospitals in our network with a robot and laparoscope. And it's quite funny these days when I book a surgery, book a, say, hysterectomy at the operating room, when I put it as an open surgery, the nurses may come to me, Dr. Chuang, are you sure you're going to do it open? Isn't it supposed to be laparoscopic robotic?
It's a lovely way to actually wrap up end the show, because unfortunately we've run
out of time. This is an amazing advance. Again, it's happening across the country. It's not. It's just changed surgery. Well, I want to thank Dr. Linus Chuang for joining us on Health Talk today.
And thank you, viewers, for watching. Please remember to send us your questions and comments to healthtalk@wchn.org.
We'll see you next time. And remember, robots can be your friend.